Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Topiramate. Its brand name is Topamax. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Topiramate works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Topiramate. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does Topiramate work? Well, Topiramate's mechanism of action is due to a blockage of voltage-dependent sodium channels, augmentation of GABA activity at some subtypes of GABA-A receptors, antagonism of AMPA kinase subtype of the glutamate receptor, and inhibition of carbonic anhydrase. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of tonic-clonic seizures, as well as partial seizures. Some patients may use this medication for migraine prophylaxis or prevention, and it may also be used for Lennox-Gastaut syndrome. With respect to contraindications or reasons we would not be able to prescribe Topiramate, we wouldn't give this medication to a patient who had a hypersensitivity to Topiramate or any other component of the formulation. This medication should not be used within 6 hours of alcohol use, either before or after. And patients with metabolic acidosis who are using metformin should also not use Topiramate. Note about dosing with Topiramate. So as an example, in partial seizure, during the first week, a patient would typically use 25 milligrams orally twice daily in the morning and the evening. In week 2, they may use 50 milligrams orally twice daily, then move to 75, 100, 150, and then 200 milligrams twice daily by week 6. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Topiramate, so I'll go over some of those here now. Some patients may experience flushing while using this medication. 25 to 67% may experience abnormal serum bicarbonate levels. 10 to 24% may experience a loss of appetite. Weight loss may happen 4 to 21% of the time. 2 to 8% of patients may develop an infectious disease. Confusion may happen 3 to 11% of the time, while dizziness may happen 4 to 25% of the time. 2 to 7% of patients may experience impaired cognition, and 3 to 12% may experience memory impairment. Somnolence may happen 6 to 29% of the time, and some patients may experience a feeling of nervousness. This may happen 4 to 16% of the time. 4 to 11% of patients may experience a mood disorder, while 6 to 16% may experience fatigue. 1 to 12% of patients may experience a fever. Now, some more rare but serious side effects would be Stevens-Johnson syndrome or a visual field defect. That's all we're going to talk about today with Topiramate or Topamax. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.